Can wearing gold jewelry protect you from arthritis? This image is going to live in my mind forever. If you look at all of her fingers, you're going to see how most of the fingers are really damaged, except for one of them, and it's the one that she's wearing her wedding band on.
Okay, so this is a really interesting video. This is basically a video showing pictures of someone's hands that has rheumatoid arthritis where the ring finger is preserved without any signs of inflammation or damage. And it happens to be the finger where this individual is wearing a gold ring. So, can gold rings act as a disease modifying treatment to preserve the joint in rheumatoid arthritis? It's an interesting idea because gold itself has been utilized in the past as a disease modifying treatment in rheumatoid arthritis. Now, the key thing to understand is that has typically been given intramuscular at very significant and consistent pharmaceutical grade dosages, meaning that when you take it intramuscular, you have a whole body effect that is strong enough where it not only helps to prevent inflammation in the joints, it can actually affect your bone marrow and your overall immune system as well. So that is a level effect that is certainly higher than what you would likely get from just wearing a gold ring, and certainly more consistent, namely because wearing a ring, you're not exactly sure what's the quality or dosage of the gold in the ring, how much leaching of gold is happening into the surrounding tissue as well. The next issue is, well, what about any of the constriction that the ring is doing to help reduce blood flow to the rest of the finger? It's interesting, but when you look at the way rheumatoid arthritis works, you don't reduce the amount of inflammation by blood flow constriction. That's not a treatment. Moreover, if you're reducing the amount of blood flow in a finger from a ring that's very tight, you're talking about possibly causing ischemic findings in the rest of the finger. The other thing in this case is that when you look at the picture of this person, their entire digit is preserved. So it's not just in the digits that are come after the ring, it's even in the digit that comes before the ring, which certainly does not have any blood flow constriction. The last part is there are some sparse notations in the medical literature that discuss could gold rings have an effect on rheumatoid arthritis. It's very sparse. And in reality, I can tell you that most rheumatologists, instead, what they see in everyday practice is patients saying that their RA or other inflammatory arthritis has caused them to stop wearing their rings, including their gold rings. So their rings did not act as a disease modifying treatment, but rather they could no longer wear their rings or they had to resize them to fit on their fingers. So as a treatment, I would not recommend necessarily going out and buying a ton of gold rings if you have rheumatoid arthritis. If you like wearing rings, wear your rings. Hopefully you're able to continue to wear them because your RA is under control. But I would not necessarily count on it as a disease modifying treatment to control your RA.